All right, Nemours, again, mid-sized children's health system. Part of what's interesting, though, that impacts how we do this is we're distributed. So we have about 80 locations. 80 locations. All right, so you've seen exactly these stats before, because this guy showed them to you this morning. It's the problem that we're all trying to deal with, right? As a provider, we are well aware, I think that fantastic quote that you had shared earlier was that retail is learning healthcare faster than healthcare is learning retail. Totally get it. And we need to catch up. We need to up our game and really do a better job of servicing our patient families. And that middle bullet is the one that I'll draw your attention to, because as a provider organization, yikes, 50% would leave their current physician for a better digital customer experience. I know I would, and you know, my family, I have 2 kids. We utilize retail health, right? I take my kids to CVS or to an urgent care or what have you, whatever's convenient, right? This idea that people are like really loyal to their provider isn't really true of my generation, and it certainly is not true of the millennials. So there's an app for that. Let me rephrase it. There's a wonderful set of apps for anything you might want to do. They're great tools, and people are developing really interesting, useful technology to help people. The problem is that there's too many of them. And so this creates the issue of either the patient, or in our case, the patient family, mom and dad, having to find these apps and vet them for themselves, or in some cases, they want our clinicians to push the apps to our patient families, which now means that the clinician needs to become at least knowledgeable enough about that app to push it and suggest it and support it. It's just not sustainable at scale to think that people are going to have an app for every single thing in their healthcare experience to manage what they have. It starts to feel like this is really cool, all your sponsors, and thank you all for sponsoring this cool conference, but it starts to feel like this to people, right? Like, oh, I got to have this for that, and we're asking people to know where to go to do what. When you start talking about home monitoring devices, it's even worse. We have such access to great tools to monitor people at home and get such better information about what's going on with them outside the clinic. My gripe here is that all of these devices have their own proprietary app for both data transmission up to the cloud and for presenting that in a UI to the patient family. And really, so on the left, if you imagine the device, that data transmission piece, laser on here, this part right here, you're either going, and this is, we heard about the security issue here with the BTLE. So you're either going through a module at home that's going to transmit the data, or you're using a proprietary app. So I would propose to the device manufacturers, you're adding value here with the device, and you can add value here in the cloud, add your special sauce, do your analytics, whatever. You add no value here, right? All that does is create a problem, because what I'd like to do is to have our clinicians be able to hand a patient family a device and our app, Nemours, and say, go home, it already works. You don't have to set it up. You don't have to download another app. You don't have to manage it. It already works. But for that to happen, I need this to be open for me to incorporate into the app that we're building. Somebody's got to do that, right? And it doesn't have to be the provider. And if it's not us, great. Maybe it's Apple. I don't know. I don't care. But what we can't do is to push that complexity onto our patients, because it's not going to scale. And then after, when the analytics or whatever special sauce happens up in the cloud, either that gets pushed back down into the app here. I'd like it to be the Nemours app. We can import that into our EMR and the clinician can view it, or what happens most often is that the device manufacturer has their own interface that they want the clinician to log into separately. So I'm seeing a patient, not me because I'm not a clinician, but a clinician is seeing a patient and they're in the electronic medical record, but if you want to get that data, you're really logging into something else besides. And so again, we're messing up the workflow in the clinic. We started with asthma, and if you think about managing asthma, what we could be doing to patients is telling them, well, you're going to have one application for a patient record, so write that login down somewhere. You're going to have potentially another application for telehealth, so write that login down somewhere. You might have a freestanding asthma disease management app or education tool, or there's a gazillion of them out there. So you might have to write that login down. Remote monitoring, peak flow and spirometry sort of go hand in hand. Those are similar types of technologies. Med adherence is a whole different ball of wax. For asthma, that can be sensors that go on the inhaler so that you're recording geographically where somebody is and in time where they are. But you could have all of these apps to try to help manage asthma. And again, I submit that that's not particularly useful to people. So the logic puzzle for all of this, and I think back to that really cool video that we saw, the human design folks showed us. Really cool, inspirational, aspirational video. And what was in the back of my head as I was watching that is, okay, here's an 85-year-old dude in his house. Who sold him all that stuff? And who installed it for him? And who maintains it and gets the call when the screen doesn't work anymore? And who accepts the liability when the data isn't correct? And it's great to think about all of these wonderful aspirational visions, but I'm an ops guy. I think about workflow and data flow and money flow. And I don't know how all that works. I love that video, but I don't know how it works, particularly in our system. So what we're trying to do, and the project that we're undertaking at Nemours, is to say somebody's got to build the scaffolding. And I'm going to pull in everything that I can that I think is out there that is going to help our families. And this gets back to, what are we really trying to do? Healthcare is really about, for us in a pediatric organization, a kid that just wants to get on the playground. You know, we started with asthma, and we talked to patient families and to clinicians and everything. When you ask people to recount their journey of what it was like when they discovered that their child had asthma, it could be 7 years into that condition, and these families, people are welling up with tears. I'm behind the glass welling up with tears because they're recounting what it's like for them to watch their child struggle to take in a breath. And you think, my God, we've got to do better. This is, you know, getting your kid from wherever they are when they can't breathe to medical help is a long journey. And we've got to push the care. We've got to go, quite frankly, right past retail. We've got to push options for care into their pocket. And so we're trying to do exactly that. Pull everything together. The who pays, we're banking heavily on value-based care, right? In a value-based care model, if we deficit fund our initiative, we believe that we will ultimately make money because we're going to reduce unnecessary utilization of the system. That's a big bet, but that's where we're putting our money. Who distributes? The medical device people are already asking us to be the distributor, right? So if I have a connected spirometer, the device manufacturers are saying, hey, could you guys, as the provider, distribute that device? Yeah, and none of the insurance companies will pay for it yet, so how about if you pay for it too? And, oh, by the way, provider, how about if you provide the support for it? But yeah, we still want to own the data transmission and the UI. And it's like, come on, just work with us. Let us actually build that into our system. Because somebody's got to pull the information together to give an integrated, holistic view. And when you start to talk about all the promise of this fantastic stuff, AI and machine learning, if we have this fragmented marketplace, the data's not all sitting in one spot. So it really hinders what you can do with machine learning, right? You got to get the data all together in one spot to really do the best job of learning on it. And then the big Megillah is, how do you make it easy for families and clinicians? Because we can't expect our patient families to be tech gurus and to solve the problem when the Bluetooth isn't working in their house. Clinicians can't be expected to manage all of these workflows for every app and device that's out there. They need to be focusing on medicine, and we need to take the technology burden off of their plates. My group needs to get out there, build this, prove what it can do so that we can show payers that there's value in it. Because at the end of the day, we have a portion of our population that can afford to buy the technology that they need to do this. However, there's a whole Medicaid population out there, many of whom can't. And the idea that everybody has a smartphone, people like to say that, oh, today everybody has a smartphone. It's not true, right? There are people on the bottom end of the socioeconomic spectrum who do not have a smartphone, or if they have one, they've got a data plan that's only on for part of the month. It's not a ubiquitous access scenario. So I'd love to be able to go back to the payers and say, listen, it might be worth it for you to provide technology to this family because it's going to keep them out of the ER one time this year, and you make money. So the sign-up and provisioning process, because we're pulling a lot of different services together, we really had to get smart and elegant about provisioning people for multiple things as they get into it. Digital expectations set by other industries. I think you teed that up fantastic this morning. You know, they've already, people have expectations that are set by Amazon and Uber and all of these fantastic experiences, and then you get to healthcare and it's like stepping off of the moving sidewalk. And I believe firmly that people will do the right thing. They will comply with their care plan. They will take the right steps if we make it easy for them. So I think we can skip all that. So here's our problem at Nemours. We started out with the same problem, right? We had 5 different digital properties. And so we had our patient portal, our organization website, our telehealth solution, our education site at kidshealth.org, and a reading readiness program, completely separate, not integrated. And that's really what got the project started, was we've got to tie these things together for folks. And so we started with asthma, and we have a 2-pronged philosophy. One is, just like everybody else, we want to push the right tools into people's pockets to help them manage their condition. But the other piece, and a really critical piece, is to gather data about what's going on with that patient when they're outside the clinic and bring it back to the clinic, because that's what's going to dictate the care plan. And so right now with asthma, when you come in for an appointment, you're handed an asthma control test, piece of paper that asks you how the patient has been doing with asthma. And That is the accepted means of assessing the control of the condition. Well, families and clinicians alike say that they don't trust memory for that. So, well, okay, if we can make it easy enough for people to tap out a couple of answers in less than 2 seconds, then maybe we can collect that information from outside the clinic and bring it back to you, and you'll be able to identify how well the medications are working. Or, because half of kids will outgrow their symptoms, how soon can they come off the medications? But it turns out that we have to pull in a lot more than just the 5 services we already had. We got to work with a lot of other services and bring them in to really create an integrated asthma experience. So, for example, this is a medication. The medication name is coming out of Epic. That's what's prescribed. Epic is our EHR. The medication name and the instructions for taking it are input. And if you used our patient portal, that's what you'd get. However, big problem with asthma is medication confusion. People get a controller medication and they get a quick relief medication, and they mix them up. And that's not good because they wind up in the ED. So we said, all right, we can work with Wolters Kluwer and dynamically pull in an actual image of this medication to show people, this is the one we're talking about. We custom developed a label to tell them, this one's your controller, and this one's your quick relief. So that will come up. Down here, remembering to take the medication is a big deal. So we built in configurable medication reminders. Just set up a reminder for yourself. Get a push notification at 7 in the morning and 7 in the evening. We custom developed, because technique is an issue. When you take that medication, you want it going into your lungs, not stopping in your mouth. So we developed how-to videos to show them how to properly take a discus inhaler, and embedded the link right on the page. That shows up dynamically based upon whatever the medication is. And then over here, we're pointing to Medline Plus for detailed information about the medications. So this is just an example of the way that we're trying to actually look at the issues associated with the condition, pull in the right services, and give people what they need right where they're looking for it. I mentioned before, we really relied on design thinking. Before we did anything, we sat down with 42 patient families. We did interviews with over 30 clinicians. We talked to other business and technology folks and did a lit review and really understood what are the problems that people face with asthma, designed solutions for them, and tried to build it. So, if you want to hit the video, this is an edited down version of a video that we did, and it's not nearly as polished or slick as the aspirational video we saw earlier.
Regina is a single mother of 8-year-old Brianna.
After
some recent bouts of coughing and wheezing, Brianna's pediatrician made a preliminary diagnosis.
So this is an edited down version, but it gives you the feeling of what it was we were going for in terms of creating a patient experience. And this was a longer version of this is what I used with our board of directors to basically pitch them on funding us.
Meet Regina and Brianna. Regina is a single mother of 8-year-old Brianna. After some recent bouts of coughing and wheezing, Brianna's pediatrician made a preliminary diagnosis of asthma. He recommended an appointment with a pulmonologist. Dr. Granger confirms the diagnosis of asthma. That's a scary moment for both Regina and Brianna. Dr. Granger explains what asthma is and how Brianna's asthma can be managed so she can live an active life. She creates an asthma action plan in Epic, prescribes controller and quick relief medications, devices that will help monitor Brianna's asthma from home, and a peak flow meter. Dr. Granger also encourages them to keep an asthma journal to bring to their next visit. It's a lot to keep track of, and Regina is feeling overwhelmed. Dr. Granger recommends Regina use the Nemours app to help manage it all. Quick, easy to understand, and accessible by any device, the app is a simple answer for a busy single mom. The asthma experience is built on top of Nemours, leveraging the security and operational rules already established, and adding new functionality. From the dashboard, Regina can log an entry in Brianna's asthma journal to indicate how she's feeling. She is able to note details, like how Brianna's exercise and sleep have been affected, the symptoms Brianna has experienced, and saves her entry. Regina is unsure if Brianna needs immediate care for her symptoms. Regina checks their asthma action plan set up by Dr. Granger. It takes just a few taps to answer some quick questions. She sees that Brianna is in the yellow zone. Regina gives Brianna a dose of her quick relief medication as prescribed. Brianna is still experiencing symptoms after taking the medicine. Did she inhale it correctly? To make sure, Regina views the Kids Health how-to video for using a meter-dose pump inhaler with spacer. Regina feels better knowing that Brianna has taken her medicine properly, but is still worried that Brianna doesn't feel better yet. So she decides to try the online doctor visit feature. This telehealth capability is built right into the new digital experience. Regina selects Dr. Vyas.
Hi, Regina and Brianna. I'm Dr. Vyas with Nemours Care Connect.
It's nice to meet you, thank you.
Yeah, absolutely. What's going on?
Well, Brianna has been wheezing and she has a temperature of about 100.
Okay.
We did give her medicine about 10 minutes ago.
And I know that you have a connected stethoscope with you. Can you
I do, yes.
We can put it up to her right lung. All right, so she is wheezing. So what we're going to do is I'm going to go ahead and prescribe her some oral steroids. It's going to be a suspension, so it's going to be just a little bit of liquid. I'm going to write all this up so that you guys can see today's summary. I'm also going to send it to your pediatrician and your pulmonologist.
Thank you so much, Dr. Vyas. I feel so much better.
On the day of her follow-up appointment, she follows the map to the facility. She's warmly greeted with a welcome message when she gets on site. The welcome message has all her appointment particulars and a number to call if she has questions. She automatically transitions to the in-building wayfinding to get her right up to the registration desk. Information collected from the app is provided for the clinician via a dashboard accessible from the patient record in Epic. This gives the Nemours clinician a window into how Brianna has been experiencing her condition in between visits. Dr. Livingston can see Brianna's journal entries and peak flow readings and notes there's nothing here to be worried about. Looks like Brianna's asthma is well controlled. All the tools she needs are right in the palm of her hand.
Microphone.
The reason we spend so much time on telehealth in the video, when families are newly diagnosed with asthma, they don't have a comfort level yet with judging an exacerbation. And so we heard loud and clear that it's Friday night, 11 o'clock, my child can't breathe, what do I do? So what they normally do is go to the ED. But an even faster route is get your child seen and heard by a Nemours clinician via telehealth who can tell you, you know what, just follow your asthma action plan at home. I think you're going to be okay. We'll check back in 10 minutes. Or, no, you really do need to go to the ED. Go ahead and get in your car. I'm going to call and let them know that you're coming. And so that patient journey is what we're trying to facilitate and really be empathetic to where the family is at and what they're experiencing and try to give them tools. Our contract, if you will, is we need to take the complexity on ourselves and pull it away from the family, pull it away from the clinician, create a team like we have and manage it for our internal and external customers. Find partners who have an SDK or an API strategy that actually support integrating with our app, which to them is a third-party app. Really think about that interface for families. Make it easy for them. Listen to what they say, iterate it, because you won't get everything right out of the gate. Evolve it, but always, always, always keep the family first and remember that that's who you're designing for. So that's it. Any questions?
Are there questions?